Chloe. I don't know if Claudia can hear me. Hi, Claudia. Can you hear me? I'm going to start. I don't know. I just need to do a quick mic and video check. I-
You want me to do a mic check? Ah, okay. Hi, Claudia. If you can hear me, can you put something in the chat? Just doing a mic check here. I can see you. You're on the big screen. Great. Maybe I'll get you just to unmute and say a few words to check the audio.
Right? Can you hear me okay?
Loud and clear. It's perfect. Okay. We're just getting everybody's coffee and getting them seated. I made them promise yesterday that they wouldn't be late. So give us a few minutes. I'll share the video with you. I made the whole room promise that they would be seated by 9 a.m.
All right. Thank you.
We'll be right with you. Thank you to everyone who is fulfilling their promise and coming and getting seated and prepared for our opening session. We're going to be starting right at 9 a.m. sharp, so that's in exactly 6 minutes. Waving to our colleagues.
Hi, Jen. Can you hear me?
Yeah, you're good. Thanks, Anna.
Hi,
Perfect.
everyone.
Hi,
Can you hear
Natalia.
me?
Yes, loud and clear.
Super. Thanks.
Wow, I'm very impressed. Everybody's seated, still 3 minutes to 9. Exciting. So just so everybody knows, we are recording this session. We would love for you to be engaged and ready to ask questions. Several of the colleagues that are joining us are staying up late to be with us. They're joining us from the other side of the world where it's evening their time. So let's please, engage them, ask questions. We're going to have a couple of different sessions. We'll get started in just a minute. I'll introduce the folks that are online, and then we'll have a couple of presentations. This session is around specifically the data strategy, and we are going to have 3 or 4 different elements of that data strategy, starting with some new indicators on violence against children. We'll start in 2 minutes. Okay. Nine o'clock on the dot. Wonderful. So let's get underway. We have the very great pleasure of being joined by some colleagues from UNICEF New York, our headquarters, and also some colleagues from the UNICEF Guatemala team, and the Responsible Data for Children initiative. So we're going to present on a few different things. We're going to hear a series of discussions all related to data and data strategy. And this is to help us with a bit of a shared vision for what Primero can do in terms of both a source of data, administrative data, service provision data, but also later we'll talk a little bit more about data security and how Primero fits into programs in terms of both a source of insights and information, but also a vehicle for standardization and for having a better global understanding of trends. So what we'd like to do is sort of break this session up into a few different chats. Each time we'll have a presenter that's going to share some information with us, and then we'll take some time to get questions from everyone. We'll finalize the session with a few of us jotting down. Remember how we have a couple of different categories here that we're focusing on for this afternoon. One of those is data and analytics. Another one is security, safety, and data responsibility. And we have another theme, another group there on data and data governance. Okay, so as much as you can, remember those categories that we'll be working with this afternoon as our presenters take us through this information. I'm going to start by introducing Claudia Cappa. We're very lucky to have Claudia with us. She's probably the most published person that I know in UNICEF. Claudia's name is on more reports than anybody I think I've ever met in this organization. She is the Senior Advisor for Statistics and Monitoring with our Division of Data Analytics, Planning and Monitoring. We're very grateful to have her here. This fellow here, this handsome devil with his hand to his face, this is Justo Solorzano. He is a senior child protection specialist from the Guatemala country office, and they've been supporting us with a case study on Primero in the Guatemala context. The Responsible Data for Children team, we see Natalia Gonzalez is there. I don't see her face, but she'll be talking to us as well. There you are. And Ana Isabel is joining us also from the Guatemala country office. So you've got a great room of people in front of you. You can only sort of partially see them, but we're representing more than 20 countries. We have child protection practitioners, gender-based violence. We've got data people. We've got techies. We've got directors. We've got a fantastic group of folks in the room. So without further ado, I would like to pass it over to Claudia to talk through a little bit about the new violence against children indicators. After that, Claudia, you're also going to give us a little bit of an update on the child functioning module, I believe. So with no further ado, I'll pass it to Claudia.
All right, what an introduction. Good morning, colleagues, and it's my pleasure to be able to join virtually to share with you first this latest development, which is the International Classification of Violence Against Children. Let me start with a couple of words of introduction about the classification, but since I'm a data person, I want to start by sharing with you 3 numbers that relate to violence against children. And I would like to see if there is any volunteer in the room to guess what these numbers represent. So we have 20, we have 35, and we have 201. Does anyone want to dare suggesting what this number might refer to when it comes to violence against children? Any wild guess?
Patrick's got his hand up.
I've absolutely no idea. Yeah, I didn't have my hand up. I literally have no idea on this one. Anyone else want to?
Yeah, at the table. What could this possibly be?
Yeah, I'm going to say percentages. So 201% increase of reported and recorded incidents across regions because of Primero. And 35 is the number of countries that were surveyed. And 20 is, oh yeah, my age. Yeah.
All right. How close were we, Claudia?
To some extent, not too far. These are the number of years. They don't refer to anybody's age. They're not percentage, although I appreciate the sophistication with which you indicated the possible increase due to Primero. Wow. These are the number of years that it will take for each country in the world to have at least one data point on the SDGs related to violence against children if they do not accelerate the pace at which they've been collecting or producing such data. So 20 is the number of years that it will take for each country in the world to have at least one data point on the SDG 16.2, which refers to ending all forms of violent discipline by caregivers at home. It's an SDG. There has been an international commitment to use these indicators to guide the action of governments between 2015 and 2030. And yet, data availability remains so scarce that when it comes to that specific indicator, it will take at least 20 more years for each country of the world to have one data point, only one data point on this indicator. 35 is the number of years that it will take. So same indicator for each country of the world to have at least one data point on sexual violence in childhood among women. And 201 is the number of years that it would take for each country of the world to have at least one data point of the experience of child sexual abuse among men. So in other words, these are three numbers that indicate that most countries in the world have not been able to produce any data on these critical SDGs. So we brought together in 2018 National Statistical Office from selected countries across the world in an attempt to understand why data availability remains so limited when it comes to violence against children, because there is no denial that this is now a global priority. Right? The SDGs represented or gave us the great opportunity to finally have an international recognition of certain priorities attached to an international framework with specific indicators and targets. And yet, in 2018, the availability of data remained very low. So we gathered National Statistical Office line ministries, because of course, when it comes to violence against children, line ministries plays a critical role in terms of providing data and collecting data related to administrative system. And we asked them why we don't have such data. Why countries are not producing these data at regular intervals. And statistical offices mention a number of different reasons. Low prioritization, compared to GDP, compared to labor statistics, there is not yet the recognition that this type of data needs to be produced by governments at regular intervals. But they also mentioned something. They mentioned the fact that there was no agreement, even within countries, even across ministries, between ministry and statistical offices, when it comes to the definition of what violence is, on how a case should be recorded in administrative records and in surveys. So there was a lack of clarity when it comes to defining violence against children and classifying cases of violence against children. But then my reaction was, wait a second, what about the convention? What about Article 19 that refers to violence and call on states to and member states to protect children from all forms of harm, encompassing physical, mental, and sexual violence, as well as the non-intentional forms of harms. Isn't this enough? Well, statistical office said, no, this is not enough. This is not a definition. So what is a definition then? And this is where I get a little bit creative here, because defining something versus providing a taxonomy, they are different concepts. And unfortunately, we had to really change the way we think about phenomena like violence against children, because from a statistical perspective, we need to come up with very clear-cut definitions. A child that is identifying as a victim of violence, for the violence that he or she was subjected to, we need to be able to classify that child as having experienced a specific form, so that the Ministry of Education, for example, or a social worker who deal with that child, and a teacher who report an episode that the child has been exposed to, know exactly the type of violence that the child has been exposed to. So the same child is classified as a victim of the same type of violence, in other words. So what do trees have to do with violence? Well, I found this as a simple way of explaining what a definition is. Because in statistical terms, a definition presupposes that we identify some common characteristics across a group of objects, and the presence of these characteristics become the fundamental conditions for something to be classified and defined as belonging to this category. So in other words, a tree, you can have different forms of trees. You can have a maple tree, an olive tree, a palm tree, but saying that a tree includes a palm tree, an olive tree, and a maple tree is not a definition. That's a listing of different manifestations of what a tree is. So to define a tree, we need to identify those specific characteristics like having branches, having roots, for example, having leaves, that when they're present, allow us to distinguish a tree from something else. So this is what we needed to do to help countries and statistical office and line ministry to really develop statistics, because they were stuck at the level of not being able to have a common reference when talking about violence against children. So we started this process of developing an international classification of violence against children. And in doing so, we started by looking at other classifications that have been developed over the years. There is a family of international classification that includes classifications that were developed 200 years ago, and they are still in use. If you think about the international classification of diseases, for example, has been in existence for many, many years, continues to be updated, and is the backbone of statistics related to health, for example, but goes beyond statistics because every doctor in the world knows that when certain symptoms are present, for example, these symptoms means pneumonia. So a doctor in Vietnam, a doctor in the US, a doctor in Cote d'Ivoire, they all have this common language and common classification of cases because they develop this classification of diseases, classification of functioning, there are classification of economic activities, classification of crimes. So we built our international classification by, first of all, acknowledging and checking how other phenomena related to violence against children are classified, for example. Statistical classification, they're also very technical. They fulfill certain specific requirements, including, for example, the fact that something can be classified only in one category and cannot be classified under multiple categories. It took us 5 years to develop this definition of violence against children, because of course we jump into regulating something for which at the legal level, at the conceptual level, in terms of the literature, there are still significant loopholes. There are significant parts that are not really yet regulated. And of course, the life of statisticians like me will be much easier if other people before us had regulated issue like age at consent. What does it mean, for example, to consent to sexual activities? When does life start? How do we distinguish, for example, rape from attempted rape? So there were a number of things that we find ourselves into that were not fully regulated, but also when you adopt an international standards, you are confronted with differences of opinions, differences in legislation, cultural differences, and bringing together a group of experts across different disciplines and contexts obviously comes with a lot of opinions and sometimes diverging opinions. So we wanted to develop something that could be finally endorsed as an international standard. So we brought together over 200 experts, from survey experts to child rights experts, to academics, to representative of national statistical offices. So over this process of 5 years, through multiple rounds of consultation, we finally came up with this international classification that was presented in March 2023 to the United Nations Statistical Commission, which is the highest governing body when it comes to regulating statistics at the international level, includes member states from across the world. And this was the first ever UNICEF-led statistical standards that was approved by the Statistical Commission, and the first ever when it comes to regulating child protection issues. So it was kind of a big deal, but it's the beginning of a process, because now what is next is work with data producers across countries to help implement this international standard. So what is violence then, after 5 years of work? This is the definition, and believe me, everything in this definition, including the commas, were the object of a long debate. Violence refers to any deliberate, unwanted, and non-essential act, threatened or actual, against a child or multiple children that results in, or has a high likelihood of resulting in, death, injury, or other forms of physical and psychological suffering. And then let me pause for a second and really clarify that for an act to be defined as an act of violence, it needs to have 4 concurrent characteristics. So each of these 4 characteristics have to be present. Otherwise, you cannot call that act an act of violence. So the act needs to be deliberate. So here what I mean, or what we mean, is that the intention to act needs to be there. So for example, if I open the door and my child is behind the door and I accidentally hit the child in the act of opening the door, this cannot be considered an act of violence against the child, because I didn't intend to hit the child. I intended to open the door. Yeah. So second, the act needs to be unwanted by the victim. And this is easier said than actually conceptualized, because as you can imagine, when it comes to certain forms of interactions, like for example, sexual activities, defining what is wanted and what is not wanted is a very complex undertaking. And we cannot generalize by saying it depends on age. Age is certainly one variable, but in addition to age, there is the relationship, right? The power dynamics between the victim and the perpetrator, the capacity of the child, acknowledging that there is an evolving capacity as well that comes with age and maturity. So the act needs to be unwanted. Third, the act needs to be non-essential. And what do we mean by that? It's an act that cannot be justified by reason of survival or fitness of the child. In other words, if, for example, in certain cases, force feeding is necessary to preserve the life of the child. In this case, even if the act that is perpetrated against the child is deliberate, is unwanted, might be unwanted, and might even be harmful, it is an essential act that is needed for the survival or the fitness of the child. And last, the act needs to be harmful. And one might say, well, it's very obvious. To define harm is very easy. Well, it's not, because of course, in considering harm, we are looking at short-term harm, but also long-term harm. And it's true that there are certain exposure that children might experience in their life for which the research is not straightforward. We do not know yet, for example, in a clear-cut manner, that exposure of a child to violent video games, for example, has short or long-term emotional or psychological consequences. There is no clear-cut literature. It depends on the intensity of the exposure, etc. So we included this condition, but it's true that in reviewing the different manifestation of possible violent acts, In some cases, we were not really sure that the harm was there, and therefore you will not necessarily see these manifestation of violence captured in the international classification. So then for each one of these different, once we define violence in general, then we organize the different categories of violent acts in this category: homicide of the child first, physical violence against the child, sexual violence against the child, psychological violence against the child, and neglect. Because in capturing the act, we also include acts of omission, which fall under the classification of neglect. So for each one of these categories, then we provide very specific definitions. So we qualify the generic definition by describing the nature of the act and providing more details. And I just wanted to focus on one particular definition, which is the definition of neglect. Because we had, of the 5 years spent on the international classification, 4 years and 11 months were about neglect. We finally realized that we needed, in the case of neglect, to really unpack this concept of deliberate act of omission. So neglect is defined as the deliberate, unwanted, and non-essential failure to meet a child's physical or psychological needs, protect the child from danger, or obtain medical, educational, or other services when those responsible for the child's care have the means, knowledge, and access to services to do so. In other words, we define neglect when the act of omission is deliberate. So if the parents of the child do not have the means, they do not have the knowledge, or they do not have access to the services, this act of omission cannot be classified as act of violence. In other words, parents are not criminalized or they are not accused of having committed violence if they cannot afford, for example, to provide the child with certain type of care or to protect the child from danger. This only happens if the parents have the means, the knowledge, and they still fail to do so because it's a deliberate failure to do so. This includes also act of neglect perpetrated by the state. Then for each one of these categories of violence, we then include subcategories. So for example, under homicide of the child, we regulate and we describe what is intentional homicide, what is attempted intentional homicide, what is non-intentional homicide, as well as other acts leading to the death of a child. So as you can see, so the ICVAC is a backbone upon which we can then build all the questionnaires that then allow to classify a child in these different taxonomies that are created with the different manifestation of violence against children. We also provide guidance on how to collect the information about the background characteristics of the victims and the perpetrator. Some of these characteristics are essential, are indispensable to qualify an act as being an act of violence against the child, while other characteristics are considered a minimum set that needs to be collected to have a basic understanding of what occurred. And then we have additional information that will be good to collect if possible and feasible, and will allow for a better understanding of, for example, the circumstances of the violence. So I want to conclude the presentation of the ICVAC talking about the implementation plans. So what's going to follow? Well, we realize that being this a framework, we will need to develop a set of questionnaires that can be used in household survey or can be used in administrative data system to collect information about the occurrence of these violent acts. So we will be develop a series of data collection tools but we will also provide capacity building opportunities to data producers on how to actually implement the ICVAC into their different data collection systems, whether these are survey or again, administrative data collection efforts. The ICVAC is currently available in English. We are going to be releasing the Russian, Spanish, French, Arabic versions in the next month or so. And then in 2024, we will start working with the core set of countries in supporting the country uptake of the international classification that will be also accompanied by a manual, for example, and different type of guidelines. So I'm going to stop here because the second part of the presentation has to do with the child functioning module. But I'm going to stop here to see if you have any reaction or any questions on the international classification of violence. Thank you.
Thank you very much. Round. It's amazing that we're all working in this space called child protection and that we don't even have a shared understanding of what violence against children means. I find that remarkable. Questions for Claudia on the content so far? Okay, please introduce yourself and then pose your question.
Thanks, Claudia. I'm Steve from Save the Children. Just a quick question. This is remarkable, and bravo on getting it through. Who exactly was consulted in preparing this?
So Steve, thank you for your question. We invited all statistical offices of the world. The invitation was to consult was sent to all the chief statistician of all the countries in the world. We had 43 national statistical offices that were actively engaged in the consultation on the draft and in the pilot testing. And this includes a very diverse group of statistical offices from Israel to Saudi Arabia, Cote d'Ivoire, Sweden, Italy, Canada, so very, very diverse set of statistical offices. Then we had international agencies, civil society organizations. We have the representative of the Committee on the Right of the Child. We had 15 government institutions, 22 academic institutions. So all in all, a little bit over 200 different experts.
And 5 years of concerted effort. It's remarkable.
And 5 years of fierce debates.
I wouldn't want to be a translator trying to translate that into multiple languages. Another question here. Please introduce yourself and then Ash.
Thank you so much. I think, yes, this is remarkable. I can relate, like even within small countries, 3-4 different child protection officer will categorize the violence differently, irrespective of the national legislation. So I think this will be really helpful with data collections in different level. My question is when you mentioned about the neglects, and that include the states as well. We know that it's a great thing because we know many states deliberately not prioritizing the child protections. For example, even in the practice itself, for example, Ministry of Educations, and then you have schools who refuse to take on a child who is being raped because the child is being raped. Now the school cannot accept you, and that's a deliberate neglect. Now, what will be the consequence if there is no national legislation that regulates that? Will the Child Rights Commission now that hold those countries accountable for this? And, how can we take it to the Child Rights Commission? Thank you.
I hope you can answer that question, Claudia. It's on you.
All right. So let me give you the official answer. The official answer are statistical classification are not meant to serve a bigger purpose than helping statistician count. Having said that, it's true that statistical classification in the past have been used actually to broaden up legislation or to advocate for broader changes that have not much to do with statistics, but have a lot to do with actually the way in which regulations and laws are implemented in a country. And I'll give an example. Take the case of corporal punishment by parents or primary caregivers. The statistical classification is not there to be used by somebody who wants to advocate for criminalizing corporal punishment in a country. The statistical classification is just meant to be used if you have to count a child as a victim of violence. And if you use the definition that we have included here, if a child is slapped, no matter who does it, no matter the motivation, this child needs to be counted as a victim of violence in administrative records and in a survey. Even if the legislation say that only if the slap is perpetrated by by a stranger, it counts as an act of violence. Well, the classification is now being used to say there is an international standards that say this needs to be counted as an act of violence. Why this is not recognized in my legislation as being an act of violence. So the purpose of the classification in principle is not to be used beyond the determination of counting rules, but it could be used by good advocates exactly for the purpose that you mentioned, by saying, here there is an international standard that say if a state that has the means to provide education to children discriminate against a child and deny the child of the right to education, here it says as violence against children. So I hope my answer is, even if it's convoluted, gives some impetus for suggesting broader uses of statistical classification that are international standards, even if the right answer I need to give is that statistical classification are meant to be used for statistical purposes only.
It's fascinating, really, and I hope those numbers that you presented at the beginning of your session that were not the age of the women at the table over here, by the way. I think hopefully this will help us accelerate a little bit on that front. And Claudia, I'm going to say that because of a time constraint, we should jump into the module on child functioning, so that we're socializing and sharing all this important work that's been done. If you wouldn't mind just pivoting into that.
Absolutely. Thank you, Robert. So now really we switch topic, and I'm going to talk about the child functioning module that was developed by UNICEF and the Washington Group and released in 2016. So the child functioning module was developed by UNICEF and the Washington Group with a specific purpose. The purpose was to have a tool that would allow to identify children with functional difficulties in population level data collection. So this is not meant to be a diagnostic tool. It's not meant to be used to provide diagnosis about children's impairment, for example. The purpose of this module is consistent with the biosocial model of disability. And this is what I mean. This is the International Classification of Functioning that was developed by World Health Organization and define functioning within the broader context of health. So in the International Classification of Functioning, disability is conceptualized as being the result of the interaction between an impairment that is linked to a disorder and a disease. So this impairment, if is not addressed through services, through assistive devices, result in activity limitations. And these activity limitations, again, in an environment that cannot accommodate those individual and children with activity limitation, this activity limitation may have an impact on the participation of children. So, for example, to get a very clear, a simple example, you might have low vision. You might have, for instance, myopia. And then if you don't have glasses, you have difficulty seeing. And this difficulty seeing, for example, might affect your ability to participate in school because you are unable to see the blackboard, you're unable to learn, and this might result in you dropping out of school, while the same impairment with glasses could be addressed and could lead to very different outcomes. So the child functioning module was developed to identify children with activity limitations. Why we are focusing on activity limitation? Because activity limitation is what really matters in terms of children's participation and quality of life. Because myself, without the glasses, I would not be able to work in UNICEF. I will not be able to present tonight. But myself, with the glasses, I was able to complete my studies, get an education, get a job. I'm able to see my screen. I'm able to present today. So what really matters is not just the impairment per se, but this interaction between the impairment and the environment, because the environment has the ability to address the impairment or not. Yeah. But also we are focusing on activity limitations because when it comes to diagnosis, those who can provide diagnosis are doctors. Of course, you can ask a parent whether a child has a condition, provided, of course, that that parent was able to take the child to a doctor and the doctor was able to provide the diagnosis. So in many contexts, in many countries, accessibility to doctors or diagnostic tools are not available. So if we want to reach a person who knows the child to a point of reporting about the child's ability to function, we need to talk to mothers or primary caregivers, not necessarily to doctors. So the idea was, let's ask mothers or primary caregivers, and let's ask them about things that mothers or primary caregivers can actually observe, and they can report by providing quality information. So the child functioning module was developed in a form that asks mothers or primary caregivers about the functional difficulties that the child might have in doing certain daily activities. Seeing, playing, learning, concentrating, walking. To help the mother understand that we are asking her about difficulties that are not typical for the child development, the questionnaire has been structured in a way that sometimes at the beginning, the question opens up by saying, compared with children of the same age, does your child have difficulty, for example, walking or other type of difficulties? Now, we are covering children age 2 to 17. We try to develop similar questions for children younger than the age of 2. But we realized that it was very difficult for two main reasons, and I'm simplifying here, of course. First of all, because children so young, they are in the constant process of development, and this development occurs at a very different pace. Those of you who have been exposed to children know that one day a child might barely walk and the next day he might start running. And certain children start walking at 9 months, others walk at 14 months. So all of these are absolutely typical. This variation is typical. Therefore, it's very difficult to have questions that allow you to differentiate what is a normal pace of development from an actual difficulty in functioning. But also because when we ask mothers, we need to be able to ask mothers things that they can observe. And children who are very young are not still able to manifest certain functioning. We cannot ask a mother cognitive related questions for a child who is 9 months old because certain functions do not manifest until later on in life. So for children 2 to 17, of course, we had to develop two different modules, one for children 2 to 4 and another one for children 5 to 17. Because as children age, their functioning becomes broader, more complex, and you have the possibility of observing children in different domains, because they might start to go to school, they might be expected to socialize outside the household, etc. So we developed 2 questionnaires for these 2 age group. One questionnaire has 16 questions, and the second questionnaire have 24 questions, but these are not unique questions. Some of these questions are skipped depending on the way the mother responds. The response categories reflect disability as a continuum. So from no difficulty to some difficulty to a lot of difficulty and cannot do at all. So we use 4 response categories, but then we classify children as having functional difficulties only when the mother says that the child has a lot of difficulty in the different domains of functioning or cannot function at all. The reason why we do not pick up some difficulty and we don't classify those children as having functional difficulties, because we realize after years of cognitive and field testing is that respondents, when we interview mothers or primary caregivers, we pick up a lot of expectations and concerns that parents might have, which are not really justified. Because of course they reflect also the emotional attachment, the expectations, the worries, all things that parents bring when talking about their children that are really not they are not justified by an actual assessment of the difficulty, particularly for younger children. And I just want to conclude by showing you the type of domains that are covered by the 2 modules. So in the case of younger children, we ask about difficulty in seeing, hearing, mobility, fine motor, communication and comprehension, difficulty controlling the behavior, difficulty learning, and difficulty playing. In the case of children 5 to 17, we have a broader set of domains, which include those for the under 5, as well as difficulty accepting change, difficulty remembering and concentrating, difficulty making friends, difficulty with self-care, and also difficulty in expressing and regulating emotions, with questions on anxiety and depression. So I'm going to stop here because I wanted to give you a high-level overview of the child functioning module, but please do not hesitate if you have any question. I would be happy to address them. Thank you.
Thank you so much, Claudia. It really is fascinating. They don't seem like complicated questions, but if you try to, in this room, to get a consensus about simple things like, is this child a survivor of violence, or does this child have a disability, we would struggle to come up with a common understanding of those things. So this is really pivotal work, and this is something that together we can actually strategize on how Primero can align with this. Does anybody have any questions on the child functioning module? One over here. Mohan, please introduce you.
Hi, Claudia. Thank you for the amazing presentation and insights. I am Mohan from a regional office here in East Asia Pacific, working with child protection team. So it is brilliant, this piece of work by UNICEF and Washington Group. So for a couple of few years, like we have been thinking, how can we implement this? Especially in administrative data. So when it comes to survey data, because I've seen this since the mix introduced this, and it's like, and we have different domain and also this functionality. So it is like 10 pages long, like survey. So if we are looking into Primero or other kind of administrative data that we'd be collecting, how can we use this Washington Group UNICEF, this classification, when we don't have all those space, energy, or whatever for 10 pages long questions.
So another question about implementation, Claudia.
Mhm. All right, so we know that asking one question will be the dream of all statistical office. Can we ask just one question and we say, is your child disabled, yes or no? Obviously, this will not work. We know this now by having looked at this over the years. So the child functioning module has been developed to be the shortest possible module to capture the largest population of children with disabilities. So each question corresponds to a domain of difficulty. So if we drop a question, we drop children who have difficulty in that domain. So for example, we can reduce the questionnaire by dropping the questions related to mobility. But then if we drop the question related to mobility, we will not be able to capture children who are wheelchair users, for example, of other types of mobility restrictions. So again, reducing meaning eliminating from our assessment a group of children. In administrative data systems, we have to remember this data system might have a specific focus, and sometimes this focus is narrow because you might want to have questions that determine eligibility for grants. And a ministry, they will not want to give disability grants to 15% of the population. This for sure, because they have a cost, they have a limitation. So they might want to restrict the child functioning module to be used as an eligibility tool, for example, only for children who have sensory difficulties or have cognitive difficulties. In this case, you can reduce the number of questions because you reduce the size and the scope of the population of children with disability. If you plan to use it for EMIS, in Education Management Information System, is because you are trying to identify your student population who have difficulties, for example, related to learning, or they might have accessibility needs. In this case, again, you can chop off some questions from the child functioning module, but when doing so, you have to recognize that you are also eliminating in your target population some children that have functional difficulties that are covered by the domains that you drop. And if you want to include the in EMIS question related to disability, you might not want to reduce the population of children because students might have different needs.
This is a point where my technology interest becomes relevant because through a well-designed interface, the user experience for actually capturing this data can be really improved. Mohan's referring to what this looks like on paper. What it looks like to do this process on paper is you pass that document that form to anyone and they're going to go, oh my goodness, this is a lot of work. But we can design this digitally to be very intuitive and quite straightforward. And so one of the reasons that I wanted Claudia to share this with us is it is a part of our roadmap to start to design how we implement this across all Primero implementations. So how many of you work with a Primero implementation that has, or a form that has a question about disability on it? I mean, it's pretty much every single implementation we have in the child's data, personal data, that part of your forms, almost always we're asking this question. So it's a bit of a step for us, but this is something that's achievable for us to implement. Claudia, thank you so much for your time. I know it's late there. You're more than welcome to stay to the end of the session. The next group's going to present on responsible data for children case study in Guatemala. But we'll completely understand if you have an episode of something you have to watch on Netflix now. But thank you so much, everybody. A round of applause for Claudia. Thank you for joining us. We're very privileged to have that much of Claudia's time. Thank you. So we're going to move along on our agenda now. We're doing okay for time. We have this presentation from our colleagues in Guatemala. I wasn't 100% sure, Natalia, if that's you or Justo that's going to lead that, but I'll just hand it over to you, and we're going to try to get through the presentation, let's say in about 20 minutes, so we have some time for questions, okay? Over to you. Thank you.
Okay, thank you, Robert. I don't know if you can hear me well, but so we will, thanks. We will present them, I mean, myself and Justo. So, hi everyone, good morning and good evening. It is a pleasure to be here and to be also hear from all of you and learn from other experiences. My name is Natalia Gonzalez Alarcon. I'm a research fellow at the GovLab, which is a research and action tank at the New York University. And today we will be talking about the responsible Data for Children initiative, in particular about the implementation of Primero in Guatemala. So for doing so, as I mentioned, Justo Solorzano, the Chief Child Protection Officer at the UNICEF Guatemala, will be joining us today as well. So let me start by talking about the Responsible Data for Children initiative, or as we call it, RD4C. So the RD4C is a joint initiative between UNICEF and the GovLab at the New York University to highlight and support the best practices in handling data for and about children, to identify challenges and develop practical tools to assist practitioners in evaluating and addressing the challenges, and encourage broader discussion on actionable principles, insights, and other approaches for responsible data management. So in summary, RD4C refers to a set of principles, practices, and tools that can enable the responsible handling of data for and about children. So let me start with the principles. So in terms of principles, these are the set of principles that we have been identified as the recommendations to steward the data collected, the data stored, shared, analyzed, and used to save and improve children's lives. So we will talk about this in more depth later in the presentation. And now about practices. So the advantage of being a principles-led initiative is that regardless the country, the sector, or the situation you work in, the responsible data practices can be implemented. So this is a growing community of practice ranging from nutrition to immunization and child protection, from DRC to Ukraine and Guatemala. So we always can apply this approach. So for example, today we will be talking about a Guatemala case study in the child protection sector. And in terms of tools, we have developed a number of different resources to highlight and support these best practices, but also to apply the principles that I mentioned into practice. So to both protect data and make sure it is being used properly and to its full potential to help children, we need to develop and mainstream attitudes and behaviors that prioritize data responsibility throughout the whole data lifecycle. And that's what we aim to achieve through RD4C. And before closing this part, I want to invite you to check out our website, rd4c.org, to check out our resources. Everything is open access, and we want to welcome you all to become part of this community. And I'll stop here because I already gave a quick introduction of RD4C, and I'll pass the floor to Justo, who will give us a context of our case study on Guatemala. So Justo, the floor is yours.
Thank you, Natalia. Hi, everyone. My name is Justo Solorzano. I am the child protection specialist from Guatemala. I would like to be there, but I am here from Guatemala. Okay, I'm going to talk about the context in Guatemala about children on the move. And I will try to explain how this context forced us to implement this platform that we call Primero. Guatemala, the context is that we have a lot of children around our country, around the region. The number of children and adolescents on the move in America Latina and the Caribbean reaches a new record height amid violence, amid political instability, and social changes that we are suffering this year. 1 in 4 people on the move in LAC is a child. This is the highest proportion globally, and the proportion has increased from 19% in 2019 to 25% in 2022. In this moment, we have this highest proportion globally, and this is a big number that we need to attend because this is a great emergency that we are living now. Next, please. These are the total numbers. We are talking just in this presentation about the nationals from Central America, but we have to think that there are other children from South America that cross Central America that we need to plus to these numbers. In this case, you can see that we have unaccompanied children are more than 114,000 children, and there is a big number that across not just Guatemala, but that across from Panama to Guatemala, and then they try to arrive to Mexico. And this is incredible because you can imagine an unaccompanied child that is in these countries. Next, please. Normally, the unaccompanied children are detected in Mexico, and they promote the return to Guatemala. And every year we have more than 15,000 children return from Mexico. And we have other number, not more than 500 children every year return from Estados Unidos. And we have a problem here because, next please, I just want to mention the problem. Because normally we have these children and we have, I think, as your countries, a lot of institutions that we try to create this child protection system. And we have the problem that every institution has his own registration, and there is a fragmentation of the information, and we need to unify all the information in one register, but not just to collect the information. We need a registration to follow up every case. And for this reason, we present to the government Primero, and they were so interested. Next. In 2020, we have the Secretariat of Social Welfare of the Presidency, SBS, we talk in Spanish, and we show them Primero as platform that allow us not just to register every case, but it allow us to follow up every case, and this is important for us. We think in two phases, two big phases, two different phases, because we want to implement this platform. We developed the platform in two main phases. In the first one, we work on the adaptation of the language. It was not only translation from English to Spanish, but also it implied the adaptation of the technical language. We work with psychologists, social workers in the construction and revision of children information formats. And it take, I think, more than 1 year. And then we start to test the Primero in reception shelters, in 2 reception shelters. We have 2 reception shelters. This phase aimed to evaluate the system and the response. The government was very happy with this pilot project, and we start the last year, 2020, the second phase, because the second phase implies to use the platform Primero at departmental level. We want to use the Primero by the department protection offices, and we are thinking in the future. We are talking in this moment with the new government to promote as part of the second phase, also including registration, not just children on the move. We want to register the child victims of violence too. We are in this moment in the second phase. The first phase include accompany, and children in transit, and this is a very challenge for us. We include all the services that we give the children on the move. Next. And in this moment, we are in this phase 2. We would like to scaling up Primero at national level. We want to extend the use of Primero to other child protection process. As I mentioned, we want to use offline feature. And we want in this moment to have some conversation with the new government, because we want that not just social SBS, the Social Secretary of Protection, will use Primero. We would like that other national entities like Health Ministry or Education Ministry could use Primero. This is our challenge in the next year. Thank you.
Thank you, Justo. And I'll continue talking about the case study. So what we have learned after talking with different actors, stakeholders, workers, professionals that work with Primero in a daily basis. So first, why an RD4C approach is appropriate and effective in this case? I think we can name many reasons, but I want to mention a couple. So first, we can say that children are at the forefront of datafication. So every year, the average child will have more data collected about them in their lifetime that would a similar child born any year prior. Also, because children have less agency, so children typically don't have full agency and understanding to make decisions about their participation or not in programs on services. And related to that lack of agency, some children's interests can be overlooked, especially with, we have an immense, huge amount of data, and sometimes there is real risk that existing obligation of protections might be overlooked as well. And another reason is because, and I particularly, when I read this, I particularly like this approach, because there is a risk of revisiting trauma, because many of the children, especially in programs like Primero, or in general in programs related to the child protection sectors, many children have suffered trauma, both physical and psychological. So the risk of re-victimization or revisiting trauma is high when you don't have the appropriate approach to data management, right? So in summary, we can say that RD4C is an appropriate approach because it It enhances the child protection by integrating the RD4C principles. It creates a child protection system more robust, coordinated, and effective, and also because it has this unified framework and it covers the whole data life cycle, which goes from planning to usage and insurance, and by then ensures data coherence and integrity. And that is related to the principles. I'm not going to go into details about the principles. Instead, I would rather to tell you some specific examples on how Primero in Guatemala is applying the RD4C principles. So I want to mention a couple of them. So the Primero, part of Primero's data collection process is obtaining the informed consent from children and their families. This ensures that participants are fully aware of the inclusion of the child in the program. Also, in Primero, the privacy by design principle is key. It means that the user profiles are differentiated based on the specific roles of each user. That approach ensures that access to data is appropriately controlled and aligned with every user's responsibilities. Also, I want to highlight the data minimization approach, because for Primero, data is not about collecting less. It's about optimizing the use of what we have. So data minimization involves strategically using data to extract the maximum value possible, ensuring efficiency and reducing unnecessary data accumulation. And there are other two related to anonymization, but also about security measures. To safeguard the data, what Primero does is to adhere or follows the Open Web Application Security Project recommendations. There are basic but very solid foundations for data protection that focus on critical security measures that are fundamental and crucial for the protection of especially sensitive and sensible information, which is the case on this context. So these are some of the practices that Primero has implemented to follow and apply the RD4C principles. And now I want to talk about what we have learned after, again, talking with different actors, stakeholders, and so on. And I want to highlight some findings. So the first one is that we can say that Guatemala was a pioneer in the adaptation. I think Justo mentioned it earlier, that Guatemala was pioneer in this adaptation. They not only were the first to translate and adapt the Primero platform into Spanish, which opened the door to other countries to kind of adapt and adopt the Primero platform, but also they were the ones who developed specialized user guides and scripts tailored to different user roles. For that, UNICEF developed more than 20 different scripts for using testing and guides for each type of user. And during that process, we can say that this has been a continuous platform improvement. It has been a continuous process of adapting the platform by incorporating the feedback from different users. For example, they have incorporated new reason for closing and to redirect cases as one example of many. And in this part, I want to highlight one of the advantages that was frequently highlighted during the interviews, and is the system flexibility and the flexibility to create custom forms and requirements tailored to the country's needs. And I think that is super relevant for potential future users or countries that want to use the platform as well. Another thing that I want to highlight is that how has been the evolution of Primero. I think Justo already mentioned some aspect of it. It was initially perceived as a registration tool for migrant children's cases, but it has evolved into a more comprehensive case management platform. And this has significantly enhanced the capabilities of the Secretaría de Bienestar Social because it has improved their capacity to handle the cases and to support and to better allocate and better support the children and families. And the last two things that I want to highlight in terms of findings are related to this process or how Primero has created a comprehensive child information system that was not in place before. So based on the file system or the expediente, now Guatemala has a more comprehensive repository of information of children. And it has integrated detailed data about children that has improved the traceability of each children's journey. And that, of course, enable a more targeted and more effective service from the government. And finally, I want to mention that something that also was mentioned many times, and that that Primero has also transformed the note-taking process for professionals. So, and this like efficiency and this like streamlined process of recording information has two key benefits. The first one is that it facilitates the faster transfer of information between various entities, including departmental offices, but also with other institutions within the government and even other NGOs that participated in the process. And what it means at the end is that it helps to accelerate decision-making processes, but also the delivery of services. And the second benefit is that reduce re-victimization. And that is super relevant because it minimizes the need to repeat the stories about experiences that children don't want to repeat. And in that way, we can protect them from having additional trauma and to ensure a more friendly interaction with the system in general. So, although the implementation has shown already positive results, there are still some challenges that have been identified during the process. I want to mention it very quickly because I'm aware of the time. But we have identified some cultural change, some resistance to change and use of technology. We already mentioned about the different perception of the platform between the registration versus a more case management platform. Who's already mentioned the translation and the challenge of translating, but also contextualization of the forms according to to different requirements for each professional. Also, a challenge has been that since the Secretaría de Bienestar Social owns the program, it still is challenges until the Secretaría can institutionalize the Primero within the Guatemala governmental framework. And also, as you might expect, the capacity building is also a challenge. There is a need to train different staff and different professionals. And final one is that the institutional acceptance of the platform terms of use has been also kind of a challenge at the beginning. But how are these challenges being addressed? Well, there is multiple strategies, but I want to highlight these three. So there are some biannual and on-demand feedback sessions to review different forms and different requirements based on the needs of the Secretaría and the final users. There is an extra support from UNICEF to provide people, human capital, but in terms of people and professionals that guarantee the Secretaria's mission and the services that they provide. And there is an ongoing training to continue the training of diverse users of the platform. And to start wrapping up the presentation, we'd like to share some opportunities from Primero, opportunities for improvement of Primero that were identified when talking with different users, especially some workers and professionals that are working on this second phase of the platform. So there is one room for improvement in terms of infrastructure, since we acknowledge the current limitations in equipment and connectivity, which is particularly critical in some remote areas. Also, as I mentioned before, capacity building needs. We need to keep working on training, and ensuring that all of the staff or final user know and understand all features of Primero to be fully used and is beneficial in the full capacity. And also there are some technical improvements that can be revised, especially when we think about the offline functionality, since that specific functionality is critical in rural areas with limited connectivity, for example. And the last one is how we can improve the rapid response based on the feedback that the users sent to the Secretaría, and of course to UNICEF at the end. So how we can accelerate that process to be able to modify in a timely manner the platform. So to wrap up, I don't want to keep talking because we don't have any more time. But what is next, and what we need to start thinking about in Primero in Guatemala is basically about these two main aspects. So in terms of sustainability and scalability, I think Justo already mentioned some aspects that we need to take into account of what is going to be next in the conversation with the new government, but also how we can provide sustainability in terms of human and financial resources, but also on how we can adapt the platform based on the need of the country, but also for the need for the political will as well. And the second one is related to the institutionalization and ownership of the platform, which is related to how for the government to institutionalize and be the official owner of the platform, to guarantee the use of the platform and the use of this RD4C approach. So I don't want to take any longer, but again, thank you so much for your attention. The RD4C, as I mentioned, is a community of practice that is growing. And so we hope we can, you can join us in a conversation, and I want you to please visit our website and our resources to have a look of what we are doing. Thank you so much.
Thank you very much, Natalia and Justo, for this amazing piece of work. When can we anticipate the publication of the case study? Before the end of the year, correct?
Correct. Yeah.
So everybody keep an eye on the Primero channels. We'll be publishing this case study. What I think is really useful is that the work that RD4C does targets the field as opposed to at a policy level. It's about how we can communicate with frontline social workers, social services workforce on how to manage data more responsibly. I think this is the real interesting thing about RD4C as an initiative. And the work that is being done in Guatemala is fascinating because it is a truly sort of system strengthening intervention that started with working with children on the move, but now it's growing into something much more transversal and much more sort of national. So let's open up the floors for some questions for the RD4C folks. Let's give them a round of applause first. Thank you for the presentation. Does anybody have any questions for Justo and Natalia on the process, on RD4C as an initiative, on the Guatemala program? Are any of you working with migration-related issues? Children on the move or other populations that are on the move, either internally displaced or migrant populations? It's a very tricky population to work with because they don't necessarily want to access your service. They don't necessarily want to share information about who they are. And that makes especially children on the move a very tricky population to work with. Anybody have any questions for the RD4C folks? We've got one over here. Introduce yourself, please.
Hi, guys. Thanks so much for this. This was very interesting, incredibly sobering, hearing the numbers of unaccompanied and separated children. And I guess my question, because we've been working on sustainability here, and something that had come up in yesterday's session was cross-border IMS and data sharing. And I was just wondering if this is something that you've had to deal with, and if data had been shared cross-border to other authorities, how was that managed, and any of the challenges that has happened with that kind of data sharing? Also, if you're doing data sharing, because I know this is government implementation, but also so many different agencies on the ground, how you've been able to manage the data sharing between all of the different types of organizations. Thank you.
Do you want to?
Yes, I want to answer. It is a good question because the main doubts that the government had at the beginning of the project is about the manage of the information and how we ensure the government that the information will be confidentially. And it implies a lot of meetings to convince them that only the governments will have access to the information. In this moment, we don't have access to the Primero, just the government manage the information, and they decided to share just statistics or other information without names or characteristics of the children. At the beginning, they have a lot of doubts. We resolved them, and now they are in charge of Primero. I want to mention that then we have doubts too as UNICEF because it implies a lot of work. But now the government is very satisfied, very happy because they have this for first time I think in this history they have a platform that allow them not just to have the information, but it allowed them to follow up every case. And we think this is the most important thing that we contribute with the government. They have the information and they decide who can access to this information. I think this is an advantage of Primero, that Primero allow the government to manage to have the control of all the information. I don't know if Natalia or something, Johnny or Ana Isabel want to add something else.
No, I just quickly add that part of what about the second question is that what is coming next, and how to define how to share the information with other institutions in order to have a scaled up system that can yeah, provide information to other entities within the same privacy and RD4C principles approach. So that's what we aim to achieve in the next steps.
We have a lot of people in the room that are from governments or working with governments, and that's one of the key questions that I have and that we hear is you may start with one agency or one ministry, but over time, how do you actually scale nationally when you're talking about including new government actors? We have one more question here. Can you introduce yourself and pose your question?
I'm Đức, T4D from Vietnam, UNICEF Vietnam. I have a question. Thank you. Firstly, thank you for your sharing. It's interesting that you talking about scale up plan to national level in Guatemala. I have one question about the ownership of the Primero, and the second question is about the resource to manage the Primero and scale up to national level. The resource you allocated, yeah, for this initiative, because the ownership is very important. If the government not get involved for long term, it's very difficult to make it sustainable. Yeah, thanks.
So yeah, that comes from the Vietnam country office that's in the earliest stages of sort of planning and some of those same difficulties, Justo, that you described about trying to meet and advocate and convince and that process. Can you speak to that?
Yes, I think that we have a lot of meetings with the government to explain them that it is not just a register system, because Primero implies allow the government to follow every cases. At the beginning, they just want to register every case. They just want to have statistics. But then we work with the professional, with social workers, with psychologists, and they discover that through Primero, they will save time and they will aim the secondary victimization. I think in this moment, the government is ownership because they manage Primero. They present Primero. They talk a lot about Primero. They don't talk about UNICEF, and it is good for us because Primero in this moment is it is a product of the government. Now we have different challenge because I want to mention that we don't have good internet connectivity in all the country, and we work to the government to facilitate this connectivity. And the other thing is a cultural change, as Natalia mentioned, because the people in general, the functionaries, the public employees, they are not used to register information of every case, and they at the beginning they didn't like, or they don't like to register every activity, but now they are so happy because after 1 year they discovered that Primero allowed them to avoid other kind of activities, of register activities, and they can review the case and they can share information just with an email or just with the index or the number of the case. We have this challenge to promote the sustainability. We are talking with the new government. The new government will be in the power the next January, the next year. And we have a good relation in this moment with them. I think it will be good for us because the new government will find the Primero in all their child protection offices, and we just need to explain them how it function. And the inversion, if we want to talk about budget, I think the next year or the next, they need to pay, I think, $20,000 every year. Is not a lot of money, but they have to invest a lot in training because we need to give technical assistance to them. We have IT person that is answer the government all the questions that the government has. They have a lot of questions, basic questions, but we need to give this support. They just want a quickly answer. If we don't provide a quickly answer to them, they think that Primero is not a good platform. But it is a challenge for us to have this immediate answer to them and to talk with them.
That's a great point. Today we're going to have some sessions on how Primero provides support to the field, and that's a great point. We have to be very honest with ourselves about that. When a government begins to depend on our system, they also depend on the support that we provide, and that support needs to be high quality and it needs to be quick. So I'm going to wrap up this session now. I know it's late for you. You're calling in from Guatemala. It's 9:30 in the evening. So can we have a round of applause for our colleagues here? Thank you very much. We really appreciate the dedication. Like Justo said, Guatemala is a trailblazer for us. They've created an opening in Latin America that we never had before. We owe them a great deal of gratitude for all the patience and hard work that they've put in. And thank you, Natalia, for your work on the case study. You're welcome to stay with us for a while. We're going to break for coffee and a snack. I'll ask everybody to come back in 15 minutes and we'll get underway with the second session. Thanks very much.